Look, the amazing thing about bones is they generally do want to heal by themselves, and so a lot of fractures we can treat without surgery. The difficulty is though that if they do need an operation, that the further along the fractures are, then the more difficult it is to do the operation and to get the bones back into the right alignment. And so that's why it's really important to have that discussion early on about what the best treatment option is, so that patients can be involved in that discussion and the decision-making process. The bones naturally actually do have they want to heal, and the biological process starts as soon as the fracture occurs. So as soon as the fracture occurs, it starts to form that healing bone and the healing response. And so as that progresses, it then becomes more difficult to adjust the alignment of the bones. Ideally, we like to get to fractures within the first 2 weeks, but there are some more complex fractures which even at 2 weeks they become more difficult to operate on. Certainly there can be some fractures that are difficult to diagnose and some fractures that don't show up on the x-ray straight away. A lot of those fractures, if they're not showing up on the x-ray straight away, again, it indicates that they can be treated without surgery, but there are a few specific ones, for example, the scaphoid in the wrist, which if we don't diagnose it straight away and we don't treat it appropriately, then we know that they typically don't heal. And I think there is a bit of a tendency in the upper limb fractures in particular, because you can still walk with these fractures. Patients will often be sent home with the fractures and told that they can be treated without surgery. But some of them can involve lengthy periods of time in casts or braces or having to wear a sling. And so I think it is really valuable being able to have an early conversation with patients about their injuries and about what the recovery process is if we don't treat it with surgery, because I do have some patients who say, I don't want to be in a brace for 3 months, not being able to use my arm. And so sometimes we do consider offering surgery to improve the recovery process as well. If we wait for it to heal naturally by itself, then generally patients will be kept in a sling for 6 weeks or until the fracture has clinically healed and is also healed on the x-rays before we let them start doing range of motion and lifting with their arm. If I do an operation on a clavicle and I have good fixation with a plate and some screws, for example, then usually I tell the patients that the sling is only for comfort and they can actually come out of the sling almost immediately after surgery for movement and for light lifting, so up to a kilogram. Sometimes the difficulty is that patients will either be seen by their GP or through the emergency department of the hospital, and their initial advice might be, to start off with non-surgical treatment and then to be seen in a fracture clinic or by a specialist at the 1 week mark to make that decision. And if we then wait 1 week until we're having that discussion about what treatment is best for the patient, then that's already 1 week that they've been waiting. The advantage, I think, of Skin+Bone is that as soon as the patient has an injury and a diagnosis, that they can send the information to us, to the specialist. We can review their imaging and we can provide advice about what the different treatment options are and what the recovery process will look like, depending on which treatment option they go for. Especially these days, patients are expecting when they go to see their doctor that they are involved in the decision-making process, and it's not the same as it used to be. You'd go to the doctor and you just get told this is what's happening. I think it's really important to have that discussion early on about what's important to the patient. I have some patients where they're very happy to stay in a cast for 6 weeks and it's not going to be a big imposition on their life, versus other patients where it's really important for them to get back to work as soon as possible, or patients where they play sport and they want to make sure that it's not going to delay their return to sport. And each individual is going to be different with what's important to them and what the best treatment is going to be. And so our role as a Skin and Bone clinic is to provide that guidance and to provide the information up front.